You're the boss.
Okay. Call to order at 16:42. That'll lead us to the Pledge of Allegiance. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. And then you gotta admit, Chris. You can just click that admit right there,
Admit where?
in the middle of the screen.
Above.
Oh, yeah.
Yeah. Nice.
I do this once a month.
I do this like almost every day now, so I'm starting to
To
learn
get
it.
really
Starting
proficient.
to, yeah. All right, so that'll move us to item number 2, roll call.
Zach,
Yes.
Joe,
Yes.
Tom,
Yes.
Lynette, Audra.
Yes.
That'll move us to item number 3, adopt the agenda.
I move to adopt the agenda as presented.
Second.
Zach,
Yes.
Joe,
Yes.
Tom,
Yes.
Audra.
Yes.
And that'll be item number 4, meeting minutes for August 27th, 2025.
I don't have anything.
Yeah, I did not.
I had no
notice it.
comment.
I'll entertain a motion.
I'll make a motion that we accept the meeting minutes as written.
Second.
Zach,
Yes.
Joe,
Yes.
Tom,
Yes.
Audra.
Yes.
And that will move us to item number 5, Director and Operations Report.
Oh boy. Can you get it up, the PowerPoint?
Dare I try?
Well, Chief, you're on. You want to give it now?
There was
somebody trying to enter. Did you see?
I can't see it.
Me either.
Me either.
See. At the top
T.
again.
Atkins.
Yeah.
Yeah, he's the other auditor.
And then, do you have the report pull, you need to pull the report up somewhere?
Yeah. She's
We'll try this again.
seeing if it'll pull up.
Oh,
There it
right,
is.
this was what caused the
This
issue.
is, yeah.
Here we go.
Gabe just has to be on the call for it to work.
No, it says it doesn't exist.
Okay, so go to the actual drive. So scroll down, and then go to the USB drive. There it is. I'm gonna donate a copy of Microsoft Office. It's like, or I'll at least show us how to get it for like $15.
Our IT person doesn't like to pay for anything, so he has us on Office 13 or something.
Yeah. I love it, I love it. It's good.
Vista.
Well, and I use that LibreOffice at home sometimes, and it's like, if you want to save a thing, then it makes you pay for the pro version.
Makes you pay for it.
Oh,
Okay, guys, bear with me. I'm gonna attempt to give our chief's report here. But he's on for questions, so.
Beautiful.
Okay, so Director's report for September 24, 2025, the financial overview. And he said I didn't have to read all of this, but I know he usually tells you the deferred property tax is $117,896. General funds, $1,687,559. The enterprise is at $2,043,531, with a total cash on hand of $3,731,090. So I'm assuming that's showing that we are down $28,908
Yeah, from last.
from last month. Yes. Year-to-date income, you guys can all see with that. The Medicaid supplement payment, he did put that in red there. That, if I'm wrong, Gabe, please correct me. We are still waiting on that, or we may not receive that.
no, we're getting it.
Just got word today that that payment will be released September 30th.
Perfect.
Cool.
There you go. There's your colors. Those are
Beautiful
for
colors.
Zach. Annual versus projected.
Nice.
Year-to-date billing performance, so January through August, we've had 1,167 transports with the gross charges at $3,702,936. The contractual allowances are $1,742,108. Total payments collected are at $864,612 with a current collection rate of 44.1%. And then he did want to make sure and note that last month he inadvertently rolled a 12-month, so this is year-to-date now. August collections is where we're sitting for August, so the June collection rate is sitting at 3.7, and if I remember correctly, that's a little on the low side, so. Oh, go ahead. Uh-oh, I thought Gabe tried to talk.
I missed. I didn't change it.
Okay. No updates from our medical director this month. And they're still working on the guidelines updates. Those are going to be coming in the next coming months. Strategic initiatives. No changes on the lease agreement at 939 Robinson. The grants, the AFG is still pending. The CDPHE is actually, he got the statement of work and purchase order today. So they weren't updated on the slides, but he just got those today. And no updates on the whole blood initiative. Shoosh. Secure transports, we did get the contract signed with Spanish Peaks Regional, so we should be starting up with them.
That's awesome.
No new news on the KISS license. We do expire October 8th. Health Service District.
What expires on October 8th?
The KISS license, so they have to do the renewal on that.
Yeah, it's the community integrated healthcare,
yeah.
Right.
the license that we got like earlier. Was it earlier in the year or at the end of last year?
We got it a year ago.
Yeah.
Oh, it was
So
actually.
yeah, so it's,
Yep.
Yeah,
Okay, I thought
And-
it was like
Yeah.
maybe rolled.
Yeah, it's coming up for the change, or for the renewal on it. The Health Service District, he did file an unopposed motion to extend for 3 weeks. The new deadline is October 17th. That's due to a case he's doing. Nothing new from San Di Cristo Hospice yet. They reached out to provide us with the transport request contract, but no updates there for last month. EMS as essential, so we're still working on that as trying to get in with legislative, trying to get that as an essential service for EMS. Treatment in place, there is, let's see, they've reached out with us on that as well. She will be working with us to create that treatment in place bill. We'll be working with them to help with that. That should bring some extra revenue in. Go ahead.
Those are two different representatives. I'll have a representative, one on each side of the aisle, one Democrat, one Republican. And they both wanted to help EMS this year. And so they came to us and said, what can we help you with? The one is really set, and I don't know if I can give their names out just yet. The one is set on doing EMS as an essential service. She said she's going to do it regardless of whether we agreed or not. So we told her we'd work with her.
I love that.
And then the treatment in place, that was another rep. They can't get, but get along, but because partisan reasons. And said, well, what can we help you with? So we brought her.
You're breaking up pretty bad. We're having a hard time hearing you.
Sorry, do you want me to repeat it or you good?
If you don't mind repeating at least the end of it.
The treatment in place
Oh.
one.
So the treatment in place is a different rep, and she just wanted to help EMS. Us to give her this and that we wanted to push this year.
Okay.
So, for the board's awareness, Chief Moreno did testify to the Department of Healthcare Policy and Finance Medical Services Board, and that was regarding the Rural Health Transformational Funds. and that's offsetting the IFT costs, recruitment, retention, infrastructure, and innovation, which that would include like your MIH and your CP programs. Do you have anything to add to that, Gabe?
So the next slide explains what the rural health funds are.
Hey, looky there. There's the rural health transformation. So this, oh, okay, so he was talking to me about this one a little bit. So Gabe, I'm gonna have you tell him, because I'm gonna mess it up.
So this is federal thing, because of the One Big Beautiful Bill, I decided to put the, and the state has to apply for it, which is why I testified to the HICPUF board. And so HICPUF, which is dictate, is who's gonna apply for these funds. Hospital clinics, EMS agencies, community providers. Basically, it's $50 billion over the next 5 years. So if every state applies, it'll be about $1 million a year, and then that'll be divvied out through a grant program that the state's gonna issue.
Okay. Any questions on that one? Sorry, guys.
I think I understand for the most part.
Okay. Here's the August Haas Safety Cloud report. Drivers alerted was 1,545. Looks like right now we're running an average of about 16 minutes scene time, but we're averaging about 7.1 minutes to scene, which to me is pretty good because I know some of our calls are 30, 45 minutes away.
Yeah, with how big the territory is, that's very good.
Yeah, some of them are, it takes you 45 minutes, so here's your colors. Where we're setting. Previous month versus the current month. So it looks like we've alerted quite a bit more drivers this month versus last month. Response time is up a little bit more. Tells me we probably had more county calls.
Mm-hmm.
These are the different meetings and updates that Chief's been involved in. I don't think I need to really read all of those. He kind of went over some of it, like the HICPUF and EMS headlines. So our recent headlines, ambulance crashes. Looks like there was 4 of them right here on this one. I don't see. Is that one on here, Gabe? Oh, here's more.
Yeah, there's more.
Okay.
Yep.
This is the one that I had read about in Chesapeake, Virginia, where a wrong-way driver crashed into the ambulance. So the ambulance was going the correct way, I don't believe they were running emergent, if I remember from what I read. The driver actually came on the wrong way and crashed into them. And I believe there was 2 dead. And then the 2 EMS providers, I believe, were in the hospital last I had heard. So just...
Died.
The ambulance drivers died?
One and then the
One and one?
Yes.
Okay. Speed and alcohol factors in that one. Ambulance service closures. Let's see. I'm trying to think one of these there was one here in Colorado. I think it's on the next. It looks like it's on the next page. There was one in Colorado that closed. What, Gabe?
Hudson Fire, the top one.
Is there another
previous
page?
page. Go back. Yeah, the one on top where Hudson Fire.
Oh, Hudson Fire.
Yeah.
Yeah, so that one's recently been pulled from the district. These ones are the assaults on EMS providers. I've had several of those. Seems to be becoming more common. EMS staffing shortages. You've got some, Washington, they're stating that they're at a critical collapse point. Just lots of problems with EMS right now with people closing. What's the solution? EMS challenges. Oh, paying the price. So these are the Colorado EMS headlines. Paramedic backs wildline crews, Colorado fire. An ED closure. Leaves only one hospital remaining in that district, that's up in Loveland. The students that were injured at Evergreen at the shooting there. Climber in Idaho Springs. This is where they get these legislation, proposed legislation. Oh, I like that. Look, no new legislation.
Can you guys hear me okay?
Yes.
Yep.
I wanted to push this out for EMS advocacy. So because I'm an advocacy assistant for the National Association of Emergency Medical Technicians, we really need to push this bill. So this bill is for the Medicare extenders. And does is because gives us an extra 22.6% Medicare funding reimbursement. And this one expires on September 30. So if we don't get this approved, we stand to lose 22.6% extra funding until they approve it. So anybody can do this. Follow that link that's at the bottom. It'll take you to a page that you can go to take action. On Protecting Access to Ground Ambulance Medical Services Act of 2025 bill. And you just fill in your information and it'll auto-populate a letter for you. And it'll pop up our legislators, and you can sit. It takes 3 to 5 minutes. And anybody can do this. I'm trying to get all of our staff to do this. There's a big push for everybody in Colorado to get this done. Bubba and I have already sent out a bunch. So if you guys are willing to do this, that would be awesome. But take a look at this because this can be helpful.
So what about the board approving a resolution and submitting it collectively as well?
They don't really care about that, and actually they don't even read the letters. It's the amount of letters that they get. So we're just basically trying to flood them with letters and get their attention so that they can sign on the lease.
Okay.
Okay,
If you guys would like, I can copy that and email it to you.
that'd be great.
Okay.
That'd make it
That'd
much
be great.
easier.
Okay. I'll do that this evening.
Thank you.
Hey, I want to see this movie. So it's EMS documentaries. It's Code 3, a raw EMS portrait. I've seen some of the highlights on it and like the trailers and stuff. And it looks like it kind of depicts a lot of what EMS goes through and what we deal with. And then, I mean, there's the comedy side to it and stuff that you probably shouldn't do. But they're always, right? It would make a good movie. But that's the new one. It says it came out in theaters on the 12th. We've all looked. You cannot find it here. We're waiting for it to come out on Amazon Prime and Apple TV, which I'm told, I read today, is supposed to be like the end of this month, so pretty close. And there's the end of the ambulance.
That is the end.
It really is the end.
Literally,
Yeah.
the end.
Uh-oh, click to exit. Exit.
I feel
Take
like
this before I break something.
that picture was for me.
The end?
Yeah.
That is the end.
That's what they call a double entendre.
Okay, and then I have the operations report also for Deputy Chief DeTrey. I was
Have
going.
somebody waiting.
Uh-oh, if somebody waited. I was going to make a PowerPoint on it, but I didn't have time today. Uh-oh. Gabe said he has to log back in because it froze up.
Throwing up?
That's what he just told me, his froze up, so he's gonna log
Throwing
back
up.
in.
Throwing up?
Throwing up. He's throwing up.
Not throw, he's probably throwing up after hearing me ramble on through his report. So, operations report. I have Deputy Chief DeTrey's paper.
Beautiful.
Okay,
was
so
ordered not to do a PowerPoint, just so you know.
I was going to.
Yeah.
I didn't have time, I was busy doing my job. Okay, so 245 calls for service, that's up 56 from last month. The on-call crew got called in once and had one transport when they got called in. Chief had 2 calls. Deputy chief didn't do any calls this month. What's up with that? We've had 35 interfacility transfers, which was down 1 from last month, and we transported 2 home from the ER to their homes. We only had 1 transport that was delayed due to the high risk assessment score, and it did go that next morning at 0800. And that was not even somebody from the emergency room. They were actually already in a room as a patient, so.
Okay.
244 IFTs year to date. IFT miles is 6,057.5, and the year to date is 46,776. Good news or bad news first? Good news, we have 6 out of 6 trucks up and running and in service right now.
Nice.
Trucks back from Albuquerque, everything's up and running, so we're good to go there on units. We did have a second injury, so we do have a second provider out on workman's comp, and it is one of our ALS providers, which is unfortunately causing us to have to run some BLS trucks during the week, which we're doing what we can do with it, but so far staff's been stepping up and helping out.
That's good.
The crew corner, can't even say it.
Hey Liz,
Yo, yes.
hey, so just one thing too, and Audra, I think you'll like this. So we continue to work hard with the hospital, and even though that we have BLS days, so that means that we can't do ALS transfers. There's been, I believe, 3 transfers since we've had to have BLS days, that the hospital stepped up and actually sent a nurse with our crews.
Nice.
And we're more than willing to do that so that we can get these patients out. So I just wanted to make the board aware that even though that we are on BLS days, we are continuing to work with the hospital and doing what we can to get those patients out.
That's
Awesome.
good to hear.
Yeah, thank you.
Okay. And that's one I added onto your crew corner, that we've been taking some nurses with us and
That's
stuff too.
awesome.
And that works out great. It gives us a chance to get to know the nurses a little better too.
Absolutely. Yep.
Right?
Forced bonding.
Forced bonding, exactly. So Caveman Music Festival had just passed up over the holiday weekend. We did have crews out there for all 3 days doing standbys. We've continued to do the farmers market every Saturday. That actually ends this month, so we won't have that no more. And we're still doing our every other Friday at the senior center. We've done some little stuff like DOC was doing a fundraiser for one of their employees with cancer. Crews went over and just ate lunch, bought dinner, and just to kind of support them. We did some Stop the Bleed education with the courthouse for them over at TPD just the other day. And then I have all of Bubba's trainings and notes that I'm not going to read all of these off of his meetings.
Looks like a lot of good meetings.
There was, let's see, let's find a good one. The MSAC Advocacy Committee. Yes, IB Task Force.
Nice.
Some good news. So unless you have anything, Deputy Chief, to add?
I had a question on the Caveman. I had issues with them. Did you guys have any problems out there that you're aware of out there? The county usually runs these programs that are in the county, even though it's city property, through the county. And I had no idea that I guess they passed a resolution last year to let the city handle it. Well, I got calls all weekend long about weather reports, things I take care of as emergency manager for the county, kayak, any incidents like the fentanyl thing we had at the other event. So I raised a question with Phil Dorenkamp, asking him why they did this, and he didn't have a good answer for me. He just said that the city was going to handle it. I don't care. It's just that it's not really how it's supposed to run. If the city's property is in the county, the county's responsible to the sheriff and the ambulance district. Everybody works around that, and we're all communicating. it's just like if there was an event at the courthouse, like a building permit, we'd go to the city for the building permit because our building is a county building, but it's in the city.
Right.
Same thing, in my thinking, it's the same way the other way around. So when this comes up next year, two things. If we're gonna run it the same way, fine, but the county needs to know what's going on. Or we need to switch it back so that the county's kind of has their arms around it and taking care of that. I don't know why they did it that way. I imagine they wanted to be more efficient, but it ended up being I was on the phone all week long because we had that bad weather
Because
all
of the
weekend.
weather. Yeah,
I
I
was
was
on
up
the
there
phone
all
all weekend.
weekend.
My normal weather forecaster that I set them up was not available. So I had to find somebody else, and then they kept calling me anyway, saying, "Hey, is it going to rain? It's thunder. What's going on?" And I asked those questions. So I just wanted to raise that. If that
Yeah,
comes
I
up,
mean-
it'll be next year. But
Yeah, really, I don't
That's
have
nothing
anything
with
to
us.
do with it.
but
They
as long
just
as you
call
guys didn't
us
have any
and-
problem, I was trying to
We
make sure we didn't have
They
any
just
issues.
call us and tell us we need
Okay.
ambulance personnel from this time to this
Yeah,
time.
Cool.
And we're just kind of basically hired on by the event. So as far
Gotcha.
as the planning and running
Okay.
of the event, nothing from
But
us.
there was a coordination breakdown
Somewhere
on my
along the
end.
line.
I
Anyway,
got you.
so just my 2 cents.
And it'd be good for us to keep aware of that happening, so that way we can hopefully mitigate that happening to multiple agencies
Yeah.
next year. I don't know, maybe it'll be better next year, hopefully,
Right,
but that
I'm not
being
sure.
aware of it, I think is good, so that way we can think about it as the next event comes up, and we know that, if there is any kind of communication issues, then maybe we can jump on it ahead of time.
Yeah, I'm trying to force the conversation about it, and I keep getting said, well, that's the way we did it, the end. And I just don't do well with that, so.
And that is the completion of both of their stuff unless either one of them have anything they need to add.
Thank you.
Thanks, Liz.
You're welcome. I tried.
Thank you, Liz.
You're welcome. You're lucky you didn't get a PowerPoint.
Look at him go, he's
I
got
know.
thumbs up and
Thumbs up.
everything. Wow.
Wow.
So any questions, comments, concerns? Then that would move us on to item number 6, unfinished business. And that'll be 6A, public perception campaign. And this is, yet again, just to kind of keep it fresh on our brains if we have anything new each month. I don't have anything specific, but I do think it's good to kind of have it just continue to be a regular thing we think about. And I
Got a
think,
cool update.
what's that?
Joe's got a cool update.
I do?
You're meeting with Kim.
Yeah, didn't I talk about that last time? No?
That was an email.
I did go, they had like kind of an open house, and after the meeting, we had a kind of a one-on-one and talked about the relationship between the ambulance district and the hospital, and it was very, very enlightening, and she had very, very positive things to say, just like we've been talking about. Everybody's talking, the ambulance employees are helping out, and vice versa, the hospital staff's trying to lend a hand also. So I asked if she'd like to have a meeting between the two boards. There was a little hesitancy there, so I'm not sure what that means. But but I think I think it's something we should push, even if one or two of us go to a meeting
Yeah.
sometime and attend, and just show a presence that we care and it's an interest, and we are dead set to make this relationship what it should be, and everything it can be. So but
I think
it
that's-
was a very nice conversation.
What it says to me is that now we know that they are directly aware that it's like, hey, look, we want to get along. We don't want to have this back and forth fighting. We'd love to just do what we all need to do together. And so I think it's a very good first step, because now we can come back again, and if we don't end up setting anything up in the near future, then we can come back again, and next time it organically happens, we can can bring it up again. And I think that's the way to do it, is we just keep trying to take another step up on that high road, and hopefully.
I told
we
them
both
this
meet
was
each other
before
there.
my time. I says, we're surely not that way. We don't want to be adversarial in any way, capacity, shape, or form. So before we develop any bad habits, let's get together and talk these things through before they happen. So very, very positive conversation. So.
Joe, do you know when they meet, or do you know,
Oof.
once a month, and what,
I don't remember. It's been
A while.
a minute since I've been on the board, so I don't remember when.
Okay.
I believe it was once a month. But
It used to be. I filmed
Yeah.
them for a while.
Yeah. But I just let it. I just threw it out there and let it be. So I didn't want to.
They have an office up above. It's hard to explain at the hospital. I know where they used to meet. They probably still do.
That's where we met in the boardroom up above
Yeah.
in the
Okay.
old building
Yeah.
on the second floor.
It would be easy enough to find out.
Yep.
Yeah. Yeah, I'm always open to it. If either of you find out, I'm happy to do some legwork if you want me to as well. But I'm always happy to attend. I can easily take off work if we need to do it during the day, whatever needs to be. I think it's very important.
Well, the
So,
resurrection, the health district thing, so that might be a good segue into getting, get into that.
Yep.
Setting up a meeting and just a conversation.
yeah, I think so too. Awesome. Any other comments, questions, concerns? That would move us on to item number 6B, 2024 audits.
So we have Chris Jorgensen, Tyler Atkins, and Max Newman on the meeting. They did all of our audit. Tyler did the single audit portion, and then they worked cooperatively to put the whole audit packet that I had emailed you guys together.
Yep.
So they're here if you have any questions or concerns, because we need to approve the financial statement so we can then submit the budgets.
There was a lot of numbers.
Yeah. Yeah, there were. I do not have a printout of those. I have looked at them.
Oh,
but-
yeah, I didn't print them out because there were so many pages. That's why I emailed them to you guys
Yeah, for sure.
last week or whatever.
Barb, if it's helpful, hi everybody, this is Chris Jorgensen. It's good to be with you all again. I was with you, I think, 2 months ago at the end of July. Some things have evolved with the audit process. Since then, we did do research and work with Chief Moreno and Barbara on the single audit. It was required as a part of the bonds. And so that work has been done. Tyler can speak to that process and how that went. Most of the financial statements that you all have now in draft form, we are ready to essentially finalize the audit, both the single audit and the financial statement audit. They're actually issued together, and then we can issue a separate financial statement audit as well. The other changes that took place, your budget was approved, so that's reflected in the new audit drafts. We worked with Chief Moreno and Barb and Sue at Wisdom to align capital that is directly used in the enterprise services. So think ambulances, medical equipment, those are now in the enterprise column per accounting standards and conversations that we've had. And then we also have reflected transfers and things like that in these latest drafts to more refine things as capital moved and those types of things. Other than that, everything else is pretty much the same as what we spoke about the last time we were together, both in the audit and in the post-audit letter. I think we did add just some language about fund alignment and accounting in the post-audit letter, but everything else is pretty straightforward. And so with that, I think I'll turn it over to Tyler to talk about the single audit, and then we can answer any questions that you all have.
Okay, thanks, Chris. I'll just touch here on the single audit here briefly. My role in the engagement is like we said, the audit of the loan program, which is your major federal program. So I think, just from a high level,
we're expressing an unmodified or an unqualified opinion on the compliance with that loan agreement, with that loan program. We do have, I don't know if everybody's seen the draft or has copies with them there, but we did have, one finding as it relates to how the loan is carried out and what some of the terms and conditions required in the loan agreement. But it relates to just some of these loan reserve and capital asset replacement reserve accounts that standards or that the loan requires you all to have set up, set aside in a different account. So again, that's the loan reserve and the capital asset replacement reserve. So, we did report a finding on that. Chief Moreno has responded with what, we require, which is called a corrective action plan, which kind of just acknowledges the finding and it's like, hey, here's our plans in order to remedy this and move forward and be in compliance and all that kind of stuff. So, but with that, like I said, I'll go back to, an unmodified or unqualified opinion on the loan program.
So
Any questions on any of that?
can you tell us exactly what the finding was that you're reporting?
Yeah, so the loan documents require you all to set up a loan reserve account, which you have to fund every year a portion for 10 years until that fund is fully funded. The fully funded amount of that of the loan reserve is 1 year's worth of payments on the loan, and so you would accrue 1/10 each year for 10 years until that's fully funded. And the capital asset reserve fund is something similar, but you are required to accrue $25,000 per year in that fund until it reaches $100,000 in total. And that's language that's right out of the loan agreement, guidance that the federal government gives, like for us who are auditing this program and for any recipients of the fund. And so those items were not done. I think, Max and Chris and team may have done some journal entries in order to make sure that those are properly presented, but those were not done by we'll say the district when we started our audit procedure. So we've got to report back on that. But like I said, it doesn't impact the compliance with the agreement or the report on the agreement.
And essentially, I assume then that Chief Moreno's response is that we'll comply with it and fund it accordingly? And that's what's also included?
Yep, exactly.
Okay.
And we had Lisa Mayers, our attorney with Spencer Fain, review that as well. She was good with it.
Good. Good. Anything else that we should know about the audit that we haven't talked about, or is everything, I know you had to put an awful lot of work into it, but is there anything else?
I'll let Chris address that from the financial statement standpoint. I just want to make one comment because we're at this point we're up against a deadline, right? And so any federal single audit is due by September 30th. And when I say due, that means there's a process that we have to go through to upload this through a portal, and then Chief's got to go in and certify it here as well. So I just want to stress that this is due, at this point next week, and so it's really important that we get this through the process here, so you guys are timely with the submission of your audit. And Chief, I'll just say if you have any questions on that part, just in regards to emails that we exchange on the Federal Audit Clearinghouse, please let me know as soon as possible, and we'll make sure that gets through the system here as soon as possible.
Okay, thank you.
Yeah, I would just add that we're grateful for the effort of Chief Moreno, Barbara, and Sue at Wisdom. It has been a long process. We talked about peeling back layers of an onion, especially with the establishment of enterprise mid-year and navigating those types of things. So that's really where a lot of the time and the bulk of the effort was spent, was aligning the activities and balances into the right location. And so I think we've talked about all that before. The post-audit letter hasn't changed much. We did talk about making sure that we're accounting for constantly things in those two columns now that we know what's in what. That should be done by the district without a lot of audit adjustments going forward. 2025, the year you all are in now, that hasn't taken place. So I would expect this next year, like the year you're in now, the books might need some more cleanup, and so that just something to have on your radar to align the internal books to the audited financial statements of where things are headed. But other than that, we're really grateful and appreciate all the work. From here, Chief Moreno and Sue at Wisdom have what's called a management rep letter in their inboxes to sign. That's dated today, and then once we get that back, we can issue the post-audit letter and the single audit report that Tyler's talking about and kick off that process. And so, really appreciate it.
Yeah, thank you.
So I just have one more question for you. Knowing that current year's books probably need those adjustments here and there as well, are you available to the district for questions?
Yeah, so we've spoken with Chief Moreno, and Chief, I don't know if you want to jump in here, but we've tentatively agreed to come in and do some work in November, December on aligning the end of year 24 balances to the audit, and then helping provide recommendations to help the district align those transactions going forward. So Chief, I don't know if you want to jump in there at all.
No, I don't really have anything to add. We had talked about getting together to get ahead of the game before we have to go through this again next year, so we'll be working towards that.
Thank you for your work.
Yeah, I appreciate you guys.
Looks good.
Yeah.
You're welcome.
I don't know, I think Chris has less hair on top of his head after this audit.
Yeah, it's already pretty thin, Barb, don't worry.
Okay.
Great, next time.
Anything else
So we do
for
we-
these guys?
No, I don't think so.
Okay,
Do we need a vote on,
to accept the financial statement for the 2024 audit.
yeah. Yeah, I'm willing to entertain a motion. I didn't see anything that I disagreed with, and Joe and I came in for the audit of next year, or for the budget. Yeah, the budget hearing. And so I feel comfortable with the way we're approaching it for next year and with the way the audit has played out, so.
Good. I would move to approve then the financial statement and get our audit finalized.
Beautiful.
Second.
Thank you.
Zach,
Yes.
Joe,
Yes.
Tom,
Yes.
Audra,
Yes.
Thank you for all your work.
Yeah,
thank you
Yeah,
guys.
definitely, thank you.
So everybody have a good evening.
You too.
Thank you.
All right, then that would move us on to item number 7, public comments.
I had nobody register for public comments.
Okay. And that'll move us to item number 8, new business. And that'll be 8A, the 2026 draft budgets. I assume,
It was in your board packets.
no.
And I did,
So I didn't hear her back. Sorry,
I know,
I didn't hear. Barb?
yep,
You guys are fun.
Bernadette emailed, and basically what was in the board packet is exactly what she confirmed and emailed to me. So she didn't make any other changes. It is what is in the board packet.
Okay. And this is from what we did at that.
When you guys all
Budget
met,
meeting.
yep, when we met to do the budget, and we met with Sue and stuff in here.
Yeah.
Yeah, that's what you created.
Wow.
And so the proposed budget aligns with what the auditor spoke to with the separation of the enterprise fund from Your general fund?
Yes, and what we may end up needing to do when we meet with them again November, December, is we may need to go in and make another amendment. Just to, if they have changes that they want us to make and stuff, but for now, since we have to file our budgets by December 10th,
Yeah.
we can go ahead and if it looks good to you guys, we can set a budget hearing for next month.
Yeah.
And then once we meet with them,
I
if
think-
we need to, we can do it again and amend it.
Yeah, I think that's exactly what, I think that makes me feel comfortable, because I know that based on what he just said, just a couple of the categories that he mentioned, and then based on being at the hearing, there are definitely a couple things that we'll have to readjust and move over into the enterprise
And you
budget.
didn't have a hearing, you just had a budget committee.
Or budget
meeting.
committee meeting, yes.
Yeah, we haven't
yes,
held up
quite.
yet.
Yeah,
Yes.
and everything
Just so
balanced
everybody knows.
out relatively well.
Yeah.
I think next year might be another story, but
Yeah.
this year, I think, seems like we pulled everything in so that when we do review it, there's not going to be a lot of surprises for you to see.
Yeah, my gut feeling is that it's just gonna be a couple movements.
It's gonna move,
Move
what's
a
gonna
couple.
happen is there's some funds income, I believe, that is gonna move from the government budget to the enterprise budget.
Right.
Right.
And a few little moves like that is all that I think is
Yeah.
gonna be required.
Because I think the big difference is that he was just saying things that are kind of like the infrastructure of the entire organization, which is kind of what we were doing already, but it was primarily transportation or wheels-based infrastructure. So there will be a couple moves, but I think the budget went so smoothly this year that it was. I'm willing to approve it, knowing that we'll have to have another budget.
Well,
committee
and I
meeting.
think those of you who've maybe been on the board for a while, and even those of you, Lynette and Audra, who are new, realize that the majority of our expenses are repetitive expenses. So it's just a matter if we have to move them from one budget to another, it's kind of all the same.
I just see, your health insurance for 2026 increased by just under $100,000. Get a horrible quote.
No, actually, we had several quotes that came in, and if we had stayed with the plan we were on, it was going to increase by 15%. So we ended up going with the same plan, but there's a premium saver plan that is extremely inexpensive, and by doing that, we were able to only increase by 2% the cost of our overall medical insurance.
Audra, are you looking at the budget?
Yes.
Okay, so I think what happened there is we moved from the enterprise to the general.
Okay.
That's what it was, I'm sorry.
Okay.
Yep, that's what that was.
Thank you, Gabe. Yep. And that was part of the major moves,
Yeah.
one of the major moves that we needed to make.
Okay.
I'm
That
sorry.
makes a lot more
That
sense.
makes a lot more sense than a
Yeah.
2% increase.
Yeah. Okay.
I should have brought my notes
That's okay.
on things that we did, but I did not.
It's okay. Everything looks good. I mean, it's almost a flat budget in a lot of ways. It's, very little increased. Do we need to approve the draft budget then?
Yes, ma'am?
Yep, I'll entertain a motion to approve the draft budget for 2026.
I would move to approve the budget as presented.
Second.
Thank you.
Zach?
Yes.
Joe?
Yes.
Tom?
Yes.
Audra?
Yes.
So I'll get that posted and get resolutions made, and we'll get that ready for next month.
Sweet. So that'll move, any questions, comments, concerns before we move on? That'll move us on to item 8B, legal counsel. And so this will be regarding an email that we all received. It's also in our board packets. that Les Downs has resigned as our legal counsel. That does not leave us without legal counsel. We still, is it Collins, Flynn, Ulmer, and Wynn?
We have them, and then we also have Spencer Fain with the
Spencer Fain.
Special Districts
Yeah.
Association, Lisa Mayers.
Yeah, so we still have a redundant amount of legal counsel, including one who literally writes the book on special districts.
Are they on retainer? I don't remember seeing anything.
I don't
Do
think so.
Do we need to do that, or is that not necessary?
They are not on retainer, but she would probably prefer that.
Yeah,
I think it's a good idea
yeah.
For a lot of reasons.
Yeah, we're not required to in our bylaws, but I do also think it would be a good idea, especially just the amount of times that, I mean, if you go and see like each time that any of the law firms pop up in the invoices, you can see each time that we speak to them and what we've spoken to them about, and it's like, that's a very valuable resource. We don't want to be without it. So I do think that it would be good to probably have one of them on retainer.
I think so,
And but I feel like we're still pretty well set with higher levels of attorney care.
Do
at
we
this
need a
point.
motion to accept Les's resignation from the board, or no?
No, because he was not on retainer, he was not a
Right.
member of the board.
Yeah.
Yeah.
Yeah, so I think it's just ultimately public notice.
Okay.
The public notice resignation letter has been in the board packet, so it can be requested if necessary.
So, just a question, is the thought process that we won't have legal representation at our meetings, our board meetings once a month then?
I think that everybody is fully allowed to request it to be there. I don't know that we need it every single time. I think that if we need to hold an item to be able to ask legal representation, or if we ahead of time are like, hey, can we get the attorneys to be at this meeting? I have a question, or I think this would be well served to have legal representation to answer any questions during the meeting. If we want to, I'm fully open to that, obviously. If we want to talk about having legal representation at every meeting, that is something that I think we should talk about.
I think the problem is, we're in a rural area. There's not a lot of resources.
Mm-hmm.
So I think having legal representation here for meetings is valuable, but it's not like there's a whole lot of people to choose from. So if we do have legal representations, probably somebody's going to have to be here on Zoom.
Yeah, and we've had that in the past with Collins, Flynn, Wynn, and Ulmer, and with Spencer Fain. Spencer Fain is a little more specific when we specifically need them for special district style stuff or election style stuff, then they tend to come in on those times. But the other law firm has absolutely come in anytime that we've asked them to. Now, I don't know if that's a regular thing that they would be able to do every month, but they have thus far.
I guess the questions I have would be, what are their rates, and would it behoove us to look at filling that position? I think in Audra's experience too, I'm not speaking of her, but I've been in a lot of places where having regular legal counsel is a wise decision.
Yep.
And those other law firms, again, how much? The first question I have is, how much does it cost?
Mm-hmm.
Is it reasonable, or do we want to find somebody that we can call on? But I don't know about you guys, but I don't know of any other attorneys locally that.
Well, I don't think our agendas normally are deep enough. They're not like the city's agendas or the county's agendas that are deep enough to warrant legal representation. And if something does indeed come up, I think that would be appropriate. And even if we are in a meeting and something comes up that doesn't work, we should table that and then make sure we have either a special meeting or the next meeting have legal representation. But I'm not sure we need to have one at every single.
That's kind of what I'm thinking.
Just my
is
2 cents.
I'm always happy, I know it's extra, but I'm always happy to do a special meeting if, say today something came up, we didn't want to make any kind of decisions without legal advice, then having a special meeting within a few days, within the next week, I don't mind that at all. I think I would be fully for that. just working with what we have is kind of what I'm looking at. Again, for me, I'm not looking to fight anybody in either direction. I just want to know what
Well, you
we
guys
think
have
we
more
need to
experience,
operate.
and you've been doing this for years. What is your 2 cents?
Well, I think there's value in having an attorney present, but, so, I mean, certainly we can afford it, and just to cover, but, again, it's the availability issue.
Yeah.
I mean, it's a struggle to find, whether it's an electrician or a plumber or a lawyer or a doctor.
Right.
So, do we want to look now, at least, and maybe solicit, to find out who would even be interested? That we could at least already have them, ready to go.
Yeah, I think that's not a bad idea. Absolutely. I assume this would be to request that Chief reaches out and helps look for an attorney, or should we do this as a board? Do you guys think?
No, I think the chief should look for an attorney.
Okay. So I think that would be an absolutely acceptable thing, is to request Chief to kind of poke around, look for attorneys, see what rates he can find, see if there's anybody that would be able to attend every meeting for a reasonable price. I don't have any real things against it. I
guess I'd want to explore what it would cost.
Yes, same.
If another meeting or two, if we, if we're comfortable with not having somebody here, okay, but
Okay.
I think we just get somebody in the batter's box and say, hey, we would like to be prepared.
Sure.
I don't want to be scrambling for an attorney if something pops up and now all of a sudden there's like, can we find somebody?
Yep.
Mm-hmm.
So
That makes sense.
Yeah, I agree with that. I think it's prudent by far.
yeah.
So I think that's a great idea, and I don't want us to ever be ill-prepared for a situation. Bless you. I think that's a great idea. This does sound like something. Would we need something we would need a vote for, is to have Chief look, or is that just within
I
purview?
don't think so.
I think that's within purview, and
Yeah.
if he can come back with some ideas on cost.
Yeah. Okay. Chief, are you there?
I made a note for him too.
Yeah, I can do that.
Okay, great. I think that would make everybody feel a lot more comfortable, especially just even at the very least knowing we have someone. If we could have someone that's a decent price and has a good track record, that we're able to, call on short notice or attend meetings, or to have a list of pricing for any of the options, really.
Can I ask you guys, without naming names, do you guys know anybody?
I know of 2 lawyers that have a private practice, have a private firm here.
Right.
So I don't know whether or not they're really well versed in government or quasi-government affairs.
Okay.
But I know a couple that I think maybe I could at least reach out to. But I also think that it's worth just kind of seeing what's available. If they're, for all we know, even if they're not able to attend in person, there may be an attorney that's a decent price and just has like a basic, I'll attend meetings if you have questions. I don't know what the resource pool looks like.
I have a meeting with the 5 counties on the emergency management thing on Thursday, and I can ask them if they, as counties, and then they have cities within the counties, whether there's, because what we really just need is somebody with a Zoom meeting, really. We wouldn't have somebody travel here necessarily.
Right,
yeah.
Yeah.
Yeah, that was.
So I'll throw the question out on Thursday and see if there's any response. If anything positive, I'll share it with everyone.
That's great. And I'll reach out. I think if we all do our part, I'll reach out to the 2 lawyers that I know of in town just to see if it's even something in their wheelhouse or not. I don't think it is, but I'll just...
Are they doing work for you, and is there a conflict
Yeah.
of interest?
No. No, I'm a public defender kind of guy.
Sorry.
But yeah, so I think that sounds good. That's it. That's a direction to move with this, and is good. A good way to prepare to make sure we don't get lost out at sea per se. Any questions, comments, concerns? That would move us on to item number 8C, JFS proposal.
Yep, so I am not happy with our accounting, and I would say that Joe and Zach agree after our budget prep committee that they're not comfortable with our accountant. And so we met JFS, Kelly Johnston, at this financial symposium that we're at today, last year. And she came in and she saved one of the smaller hospitals from closing. And she works with a lot of the health service districts that we partner with and talk with all the time. And she comes in highly regarded. So we reached out to her for a proposal, and that's in your board packet. And she does industry-specific accounting, so healthcare accounting. And I've heard nothing but good things about her. So I would suggest that the board look at the proposal and maybe approve, because that's above my spending authority, approve her services for accounting moving forward.
What are our current monthly service costs for accounting? Do you know?
$2,000 a month, and I don't feel like we get $2,000 worth of stuff.
That's weird.
Just this week, Sue didn't get us our financials until yesterday or Monday.
Yeah. Well, yeah, and just during the
And she flat out said that she can't account for credit card payments when we put the chart of accounting numbers on all of our receipts every single time.
Yeah, it was a little disconcerting, the amount of stuff, between the amount of stuff she wanted to consolidate and then the amount of stuff that she could not account for. And so I fully agree with you. Obviously the elephant in the room is gonna be that $5,400 a month is over double, obviously. But I also don't know what going rates are for good accountants. But I can say that, $2,000, I don't think we're getting $2,000 a month of service from her, but I also don't know that, like I said, I don't know the comparable rates. So, Bubba?
Audra, as a government entity, what's your take on that?
Sorry about that, Tom.
I mean, you have an accounting department,
Yeah,
so.
yeah. Does your current accountant do your payroll too?
Yes.
And they're tracking all the comp time, overtime, all of that, vacations, I should say.
And that she does that as well.
Yeah, I saw that.
Yeah. But yes, they do.
It's probably not out of line. If you look at it, just if you were paying one person as an individual to do your accounting,
Right.
it's
The struggle I had was she didn't know the
It's
answer to
right.
a lot of questions.
Yeah.
Yeah.
And then she wanted to start lumping things together. And I just said, no!
Yeah.
It
It made the numbers get very
I mean,
uncomfortable.
it really got scary there in a couple of moments. And once we said no, it started to kind of calm down a little. But she had a very difficult time finding things. I don't know where I put that kind of thing, answers.
Yeah,
it was
she combined a lot of, like fuel is on a credit card, but it's a WEX credit card that's all it's specifically used for, and she combined it entirely into credit card purchases.
Right.
And it was just one lump thing and wasn't able to reconcile fuel costs for an ambulance service. And it's like, man, that's a big cost.
That's a basic.
Yeah, that's a big cost, and it's all on one account. That's all that's on that account. It can only purchase
Little things
fuel.
like that through the whole conversation.
I've had good accounting and bad accounting.
Yeah, absolutely.
And I prefer
And
And
good
we're
accounting.
a very specific style of accounting, I'm sure.
Exactly.
And so it's nothing against her. It's not to speak
No.
poorly on her, but I do think we should look for someone more specific, someone who's more trained in our style of accounting.
And does she do government accounting in particular?
Yeah.
She does government and then industry specific, so
And
special
healthcare.
districts, health districts.
Special district and healthcare.
Yeah.
Really, it's
Bubba has his hand up.
Oh yeah, Bubba's been raising his hand for a long time.
it's reasonable.
Okay,
And
I'm willing
So
to trust that.
I
'cause-
would say after meeting this young lady in person, and we will see her actually tomorrow again.
Okay,
She is vivacious, and I think the other thing that is really important is she is industry specific to what we do and how we do things. And I think that's very important as we come to, I know it's quite a bit of money, but as we come into these challenging times and budgeting and just this audit that we had to go through, I think that will be a thing of the past with this, and I think we're gonna get what we pay for.
Well, and two, I think it's critical to have accurate accounting, especially so that next year there's not a late filing on the audit. I don't think you can file late again. And so I think it's the smart choice.
Okay.
yeah, I think I agree with you fully. It feels like the right answer to me.
and payroll has been just a continual.
I would just be
we will
remiss
talk
if I
about that.
didn't play devil's advocate for that moment. But I do
Yeah, she
think,
has.
it's worth it. It's kind of similar to how I feel about other extremely skilled professions. Yes, it's a big lump of money, but it's a thing that we really want to be able to rely on and trust.
And she was, I think trying to do a good job of not criticizing that at all. It's just, maybe she's overloaded or what,
That's
but she was
fine.
trying to take some shortcuts, and we can't afford.
Yeah, we can't afford it.
We don't want to pay for shortcuts.
So-
Well, I
so
was in that
question.
meeting. She seemed distracted to me.
Yes,
She
that's a
seemed
good,
very,
that's a great
very
observation.
distracted
Yeah.
because
Yes.
I was sitting in on
Yes.
that one. And
Yeah,
So if we agreed to do this, what sort of time frame? I mean, would this person jump
She
in
can start right
immediately?
away.
right. I would-
She's like
okay.
ready.
So,
She's ready to go next week if we wanted.
so because this would change the budget, do we have to do anything about that? Because it wasn't budgeted for?
Well,
We did account for that in the budget.
we
Oh,
did.
you did?
Yeah, oh yeah, we
I
did.
changed it. We had it
Okay.
set, so yeah.
Yeah,
yeah, I was gonna say, I had
yeah.
to-
Then I say it's obvious in our discussion.
Yeah, yeah, it is budgeted
I think it's
for.
unanimous. I think,
Yeah.
all of us are business people. We
Yes.
kind of,
I would move to approve the JFS proposal as presented for accounting and payroll services for the board. Not the board, the district, I'm sorry.
Yeah, thank you.
A second.
Thank you.
Zach,
Yes.
Joe,
yes.
Tom,
Yes.
Audra,
Yes.
Smiles.
Yeah.
She's happy.
Yeah, Barbara's stoked.
Happy girl.
I'm gonna cry.
Yeah.
Oh, thank you.
Any other questions, comments, concerns? Then that will move us on to item number 8D. That is trade-in purchase of new vehicle.
So I wanted to, throw this out there. So my current vehicle, it's a 2020 Ford F-150. We purchased it in August of 21 as a used demo unit with 30,500 miles on it. And we bought it for $42,500. Since I've had it, it's had 3 recalls and multiple transmission issues and resets. It's a known issue with that transmission, and they keep saying that they've got a fix for it, and it just seems to be getting worse. So I was going to see if we could just replace the transmission initially, and then I thought, well, let me see if they take this back knowing the issues. So they offered $21,000 for trade-in, so about half of what we paid,
Wow.
which I think is pretty awesome.
How many miles?
And so I wanted, and what's that?
How many miles now?
The current miles, when I got the proposal, it was 60,700. Right now I'm about 61,000.
Okay.
And so I had them work me up a quote, for a turnkey vehicle, that's outfitted with lights and everything. And so with the trade-in, it comes out to just under $67,000. And so I wanted to ask the board to be able to, trade in and replace that vehicle before we have some more transmission issues.
Just hit admit in a minute.
Yeah.
Yeah, what's the type of vehicle that you're trading it in for?
So I've actually got 2 quotes. My preference would be, it's a 2026 full award edition.
Expedition.
And then, what's that?
You broke up on Expedition, but we figured it out.
Yeah, it's a 2026 Ford Expedition, and it's the police model, so it's ready, it's already built for emergency response.
That was said to let him in.
And if you think about it, that we're using part of the Medicaid supplemental funds that we'll receive in the next 6 days, then we're not really out or over budget. We'll just be using a part of that funds.
So, I have a question. I know you said you got 2 quotes, but did you, and I understand probably you wouldn't get the same trade-in value, but we don't know that for sure. And, so did you solicit formal bids? Did you get quotes from any other dealerships? How did you go about getting the quotes? Do we have, did we go through a procurement process for quotes? Can you explain that?
No, so this is a company that we've used before. They're the most cost effective and cost efficient they have been. It's the same company that the city of Trinidad uses. And so we went back through the same dealership that sold us for the trade-in portion, and then they only work with this one upfitter for the upfitting portion to make it a turnkey vehicle, one price out the gate.
Is it state award?
What's that?
Is it then on a state award contract?
Yes, yes it is.
Okay, that's what I needed to know. Okay. State award is, it's, the state goes out and does all of the quotes or bidding for any number of items. And they accept and grant contracts to the various entities that come in with the lowest prices. It eliminates like local governments, schools, districts from having to go out and do their own bidding. They can use those state award contracts and secure the bids under those.
Okay.
Now, when he purchases, it needs to say it's state award, because otherwise, not getting other quotes, say it was some other piece of equipment. You don't get other quotes from somebody, we're not following state requirements for bidding. And even if it's, well, that's who we've used, it doesn't matter. You have to either have that cooperative that you're going to as your source, or you have to bid.
Cool. Okay. I think I'm okay with it as long as it's something that it can be verified as a state award service. As I do agree, we went through the same thing when we were looking at listing the building, was that we had to make sure that it was actually somewhere that people could bid and it was an open market that that allowed for the highest bidder.
So my preference, I have to say, would be that when things like this come to the board, that we're able to see the documentation that supports this, because you know, based on what you're telling us verbally, we're being asked to make a decision that's several $1,000s, and so I mean, I'm a paper person. I like to see what we're doing. I don't want just a verbal.
I can get on board with that. Is that good? So what if we push it till the next meeting to make any kind of decision on it, and you provide documentation for the process you went through and the actual pricing, and that it's a state award organization? What do you think?
I believe Liz has it.
Does it say state award?
I'm looking now to see, here, do you want to look over this one?
Yeah, I see that. I know who that is.
Well,
They outfit.
they're both the same company,
Chalmers.
so it's just
It's the two different
It's the
vehicles.
two different units. I just don't
Okay.
see anywhere on here where it says state award, but I'm pretty sure that they are.
Chief, what does a new
So it says government pricing,
It does
right at the
say
top it says
government
government pricing. That's the Colorado State Bid Award.
Okay.
So just for everybody's education, you can go online and do search for Colorado State Award contracts and see it.
Okay.
So we can verify it that way. I'm glad Liz has this though anyhow, because
So what that paper that she has there, you'll find online?
not this paper, no. What we'll find is that,
Chalmers.
that
The
they
Chalmers.
have a contract to do
Oh, okay.
vehicles, state price agreements. That's where you would find it, color state price agreements with the Office of State Controller.
Chief, what's the new transmission cost on that thing, and does it matter if they put a new one in, it's still the same type and still going to the same problems?
So a new one will cost anywhere between $8,000 and $12,000,
Okay.
and it will be the same transmission.
So you might be setting yourself up for the same failure.
Correct.
I'm a high mileage guy. I've been a construction guy all my life. I get 300,000-400,000 miles out of my vehicles. So, to trade something in at, this mileage to me is,
Unfortunately, the
it's low.
transmission.
But I had a Ford when they came out with the first diesel. They were horrible. And I got rid of them as quickly as I could. So they couldn't fix it.
Oh, no, go ahead.
Just so they can see
Yeah,
it as well.
absolutely.
The
And I'll
Duramax,
put it back.
not the Duramax.
I figure this way you guys can.
Yeah,
see
the other
it.
concern with just replacing the transmission is there's possibly a drivetrain issue
Yeah.
with the ongoing issues.
Got
And
it.
so the recommendation is always to just replace the vehicle.
Yeah.
Is this something, a vehicle that you would ever need to get to a scene?
Yeah, that's his
Yes.
it's his
Hey.
vehicle.
Then
Guys,
then
I have my,
Oh, hey, what's up?
I guess, so I had my hand up, I just wanted to say something. So, once again, and I agree, I understand Otter's concern, and I want you to know that Chief Moreno is one of the most frugal people I know. And unfortunately, he's rubbed off on me, but that's probably not a bad thing. But in addition to that, kind of where Tom was going, these are, even though Chief Moreno and myself don't respond to every incident, when we do, it's an emergency vehicle and we respond, then we need to get there. So when we start piecing together and we've already had to put 2 engines in 2 ambulances, and we've had nothing but problems with those 2 ambulances. Unfortunately, we can't replace those because they're $250,000 a piece. But when we're talking about life and safety, I think we need to make sure that our personnel are in the utmost top of the line, or not top of the line, but top running condition. I just wanted to throw that out there.
No, I agree that that's the thing that it makes me a little like nervous feeling is like, say we do get it fixed and then it just goes out again, and we don't need Chief getting stranded somewhere if everybody's backed up and he's the only one to respond to a call for something. And so that terrifies me. It terrifies me to think about like it being usually when they run to a call, it's because there's a bunch of other stuff going on and they need someone to be on scene at a high level of care for like while the other truck
Well,
is
there's
responding.
been-
Is the expedition used anything other than getting you to a scene? Because it seems like it's a very big vehicle to be running up and down the highway for just getting
So
a scene.
the only options are an F-150, the Expedition, the like the little small police that they have, but those have 0 ground clearance for some of the places that we go.
Yeah, we could put a
So
little kid
my
in
preference
there.
was the Expedition. And it's got the least amount of recalls and better life cycle value.
Seems like we need money other places, but
Hey, Joe, in addition to that, and the Expedition is a little more costly, on the price, but that also, we had we got the F-150s thinking that was the better way to go. And then we found out on all the dirt roads that we go on, everything in the back of that pickup, even though that it has a shell on it or a tonneau cover, is just covered in dirt.
yeah, I don't think a pickup's the way to go. As I did that in Arapahoe County with inspectors with the light light aluminum beds and they're bouncing all over the road. So no, I'm not doing it. I'm just thinking the Expedition. I'm thinking more of like an Explorer or something a little more, a little
Compact.
smaller, a little cheaper. You're the expert, so I'm just being devil's advocate here. Because it seems like an awful low mileage to get rid of a vehicle.
I respect that as well, and with the stuff, if you look in the back of a cheaperized vehicle, it is plumb full anyway, with stuff, and, I would say that, having the extra room and the space is much needed as well as the ground clearance.
Okay.
Yeah, that's my argument for for that compared to it, because a lot of places use like chase cars and will use an actual car of some sort.
Right.
But that's the big issue is you can't fit any supplies. Where it's like the pickup trucks are nice because you can pull the whole bed out, but then everything is covered in dirt.
I'm not
like,
picking it for what we're doing.
Yeah. So I get the. I would say that I feel the same kind of apprehension, but I do know what it's like to try and stuff your junk bag in on the full slide out rack in the back of an Expedition or Explorer.
Well, if the rest of the board is for it, I would absolutely vote for it.
I'm not finding them on state award on the list. The city has a couple of different entities that we have, for lack of a better word, partnered with, that we've identified formally that we accept as a cooperative. And so I don't know if Chalmers is on that or not. I can't for the life of me remember the name, but I'm not finding them on state award. They're a New Mexico company, I know that.
So Audra, it might be under MHQ.
Oh, yeah.
Because that's their, if you look at the next page, it's MHQ West, Emergency Services Solutions. MHQ of New Mexico.
Yeah, see, Colorado's only listing Colorado companies, that's it.
Yeah, you might have to look under New Mexico.
Which is odd because they have the Colorado contract because Radcombe Port is so close that they have the Colorado contract.
Yeah.
So let me ask you this question. It's not, do we have time to verify that it's state award? Not just government pricing, it's gonna be state award or else, because otherwise we're not doing the bidding process correctly.
I want to say that we probably do have time. My only concern is the more I drive this vehicle, the higher mileage it's going to get, the less trade-in value we're going to get. And the other thing is, because we're a special district, we don't necessarily have to go out and bid like the cities do. We can just do what's best for the district.
I don't think that's accurate. I'm gonna look. Let me look.
I don't know if this helps. We haven't had to, in all the ambulances we bought over the last, 2015 was when we started buying ambulances when Dan got here. We didn't send any one of those out for bid, and those were also bought on, some of those were bought on state grants, and they were well over this purchase price.
Yes and no. I mean, not really, because I wasn't on the board and I'm not accountable for what happened in the past, but for what's happening today, I am. And so it says, yes, Colorado Special Districts generally must follow procurement laws and are subject to their own internal purchasing policies, which are often derived from or influenced by Colorado State Procurement Code and other applicable state and federal laws. Districts must adhere to any mandatory procurement process obligations in state and federal law or funding agreements, and they often have their own rules governing purchases of services, supplies, or property. And obviously, that's just the AI response, but do we have a separate procurement code that's separate from what the state law says? Because law says special districts may adopt all or part of the Colorado State Procurement Code or must otherwise comply with applicable state and federal procurement obligations.
So, I don't know if this makes a difference. So under the special districts for the state, there are different districts. Most of them fall under municipalities, water districts, fire districts. The Broncos Stadium is its own district. So I don't know if they have different requirements. I know under some things they do. I don't know about this.
I would say we would be required. I mean, this is a quasi-governmental board, quasi-governmental district, and I think we better follow the appropriate procedures. If that means we delay this, and I get what you're saying about the mileage, but
Let's check with an attorney.
Yeah, no, I think we've come full circle, actually.
Where's Lisa Mayers?
Point taken.
Special districts attorney.
Yeah,
We happen to have one.
so that would be something, I think, to reach out to Spencer Fain about, correct? Since they are,
That would be my vote, because
they
that
are
would,
the special
we'd
district.
have a legal answer, and if we don't need them, we don't need to do that, then terrific. But
Yeah.
if we do need to do that, I don't want to get caught.
Yeah,
So on page 2 of the proposal, it says state under customer name, fleet, and then the priority code for the state code.
let me look at that.
There it is, state contract number, right there. I done this one too, just so I can show you guys too.
you,
State contract numbers are right there.
Cool.
Right here.
Oh, okay. Cool.
I'm gonna sneak behind you.
So I do agree, and next time I'll do a better job of getting this stuff out to the board ahead of time.
Well, and I know you're, and Chief, I am passionate because once you have a lemon, you know, I have gotten rid of vehicles, trust me, that are continuously headaches. So I'm compassionate about it. I just want to make sure we're gonna run into a money problem here one of these days, and I just want to make sure that we're being wise and frugal, because if we get a new vehicle, this one's gonna have to last, so.
Well, I agree, and that's why I figured if we did it now, well, we know we have the money versus if it craps out next year, we don't know where we're gonna be, or in 2 years, or however long.
Yeah, a year from now, things are gonna start, unless things change drastically, but I think for the next 3 years, we're in for a roller coaster, so.
Yeah, it'll be tight.
Okay, I think that's a New Mexico State award, but I don't think that's necessarily problematic. At least it's a state award. They've gone through that process, and it satisfies our requirement to ensure that we've gotten the best price using public funds. So, there you go. I'm okay with that now.
and I appreciate you being a stickler for it, for real, because it's just not something I know as much about. And so I really do appreciate you sticking it out, just like you, Joe, as well. Thank you.
I don't know how often the ambulance district uses, I mean, what you buy is very specific, so, but you might want to look at what other cooperative agreements are available, and we may want to visit our purchasing procedures to see if we want to adopt anything that allows us to go through some of these other cooperatives. Because there are some that do have medical equipment and what have you, and it may be a cost saver.
Yeah, I get you.
I do like that it's full, it's loaded, it's ready to go, so
Yeah.
that's nice.
I have one more question, and I'm not saying this to be
But,
When she laughs after she says that.
why a Ford?
That's what I'm so glad someone said it out
Because
loud.
let me tell you,
Yeah, Chevy or Dodge, we always had good luck
I've
with.
had one Ford in my life and transmission problem.
Hmm. Same, I've had two, and both of them are the transmission problem.
Yes, and I was told, oh, that's how it just is. It wouldn't shift out a second gear on the interstate. No, that's not how it is. Anyhow, so back to your point about ignoring.
Hey, Audra?
Yes.
Audra, just so you know, the sheriff's office just actually leased, they went into a lease agreement with an outfit,
Uh-huh.
and they got all Chevys,
Mm-hmm.
and I think 3 out of the 6 are out right now.
Vehicles,
You win for losing.
Rams.
Yeah.
Well,
Dodge.
we were told that the Chevy transmission, 10-speed transmission, is basically the cousin of the Ford transmission. They're basically the same transmission.
Well, how are the Rams doing? I know that the Rams, when I was still, I mean, it was 10 years ago, but the Rams were doing
They're
great.
fine unless you try to
Not
ram
much.
something.
Yeah, until you.
Dodge is junk.
Hey.
the Allison transmissions are
My Dodge is
pretty-
sitting in the-
pretty bulletproof.
At home broke
Yeah.
down, so.
What about Toyota?
I love my
Oh,
Toyota,
come
but I don't really think it's. I absolutely love my Toyota, but I really don't think it would hold up if I was running it
Yeah.
Like
like an emergency
serious
vehicle.
emergency
I mean, I run it
vehicles, no
sometimes
matter
with
what
that, but I don't
agency.
think it would hold up.
Oh, yeah.
It'd be
Yeah. No, yeah, emergency vehicles just get so beat up. That's why you can buy cop cars for so cheap. But it's like, I mean, driving it nicely, you beat it up. It's just how it goes. I mean, the acceleration deceleration is so bad for an engine or a transmission, and it is just the way you have to drive if you're driving with due regard. And so it's like you're gonna destroy something, and if it's gonna last for a while, I don't know why, but all I can say is I've never seen a Toyota or a Nissan as an emergency vehicle, despite how reliable they are as personal vehicles. I've just literally not seen
I
a
don't think
single
they're
place.
built for that.
No.
They're just not built for that.
No,
kind
it's
of-
too high heat.
What about Jeep products though?
Well, let's get you a Jeep Wrangler.
No, there is a police Jeep wagon here now,
Okay.
but that's a lot bigger than the Expedition.
Yeah, that's true.
Is there a mid-size something?
So the midsize is that Ford Explorer, like the police cars, but like I said, it's just too low. I looked at that for pricing, the same, to Joe's point, to be on the cheaper end. They can't get in anywhere. The sheriff's office is always getting high-centered on everything.
Well, we
Can't
could put a
get
lift
in
Yeah,
kit
what
in
about
there,
a-
we could fix that.
What about a lift kit?
Yeah.
But then you're
I don't know
messing
how much
around
of-
with the vehicle, and it's like, you know what?
You're gonna mess up that center of balance. And
I think
Yeah.
I trust that you've done your research.
Yeah, that's true.
And I do agree with the statement about how you're a stickler with money. I don't think I've ever seen someone that wasn't a finance person come in and have their hand on the finances quite as much as you do. So I'm comfortable in that regard too. I think if you've done your homework, it's a good trade-in value, and it's probably the right choice. Well, it would be for the transition.
I appreciate that.
Yeah, and I trust Chief, and honestly, the way you two are with this kind of stuff, with numbers, with governmental affairs, if you guys feel comfortable, I really do too, because I feel like you guys are both very good at speaking your mind. And
I always think
know
you
if
need your best equipment. You're always as good as your equipment.
Yeah,
So I don't disagree with, and sometimes a limit is just a limit.
Right?
No matter what you
Yep.
do, you can rebuild it, it's still a limit.
And it's the worst feeling to be stuck
Absolutely,
in
yeah.
a in an immovable vehicle when you're supposed to be running an emergency. It's just the most gut-wrenching, depressing feeling. And you can't
Honestly,
do anything about it.
Loaded, I think this is a pretty good price.
I would
Yeah,
agree
I
with
do.
that.
Because I just bought a brand new dually and Chevy Duramax loaded. And I get the discount, the Chevy discount, and it's a $100,000 truck, got it for $68,000. But it's, you know, it's loaded, and this with everything you have on it
Yeah,
is a pretty good price.
yeah, it is.
So
And does it say how many miles are on this one, or is it a new one?
this is new, isn't it? 26, right?
The
Yeah.
Expedition's at 26.
Okay,
Yeah.
0.
beautiful. Yeah, I mean, 66 for a civilian expedition is a pretty all right price if it's fully loaded.
Yeah,
So
I
the
think-
fact that it's
I
a fully
think
loaded
it is.
emergency vehicle is,
Yeah.
you
With all
can't
the
really
lights
beat
and
that.
That's all your
Yeah.
lights, your
Yeah,
everything.
that's, those light packages. are-
It is gasoline though, isn't it?
Yes.
Yeah.
Yes.
That's something I don't like, but.
Yeah.
We don't like the DEF systems.
Yeah, the DEF
Oh, DEF
systems are
system's
making
horrible.
it just awful, and it's
Yeah.
like, the way, so
That
the
is
flip side of it too is one thing we learned about idling with diesels is that's why they have the high idle, is because moisture will still build up in the cylinders with the low heat whenever you're just idling. And so gas vehicles, a lot of EMS has kind of been moving to gas vehicles because gas vehicles run at a higher temperature even at idle, and they can keep all the moisture out, and it's not quite wearing them down quite as quickly, as you'll literally start to build like minuscule but still rust on the inside of like the cylinder walls and stuff from a diesel that idles all the time like an ambulance.
Chief,
So-
on our maintenance on this stuff, you run synthetic oil or you run a regular oil?
No, we run synthetic, and we're actually running synthetic in the diesels as well.
Okay,
Nice.
all right, that's smart, okay. I am convinced.
Yeah, I think I am too. I think we've done our due diligence to make sure that we're serving the people correctly while making a big decision like this. And so I would happily entertain a motion.
I don't have the paperwork. Again, the motion needs to be complete and
Yeah,
say the
that's
price and
true.
who it's being purchased from.
Do we want to check with an attorney first, or are we comfortable that this is the state?
I think Gabe can do that, just to verify that's on New Mexico State
Okay.
Board. That should be fine. Again, it's a process where they've screened all of these
Okay.
bids.
Is there, well, do we have to make a motion on that tonight then?
Audra, if you were compelled to make a motion, if you had the
That's
Chalmers quote.
that's the
is that
quote
what
for
you
it.
want?
Yeah, that's what
Yeah.
I'm saying.
Oh, I'm sorry. I
I just-
didn't know that's what you needed.
Yeah,
from
no,
me.
I just wanted the paperwork so
Oh,
that we have a
okay.
complete motion.
I apologize.
Because auditors should be able to see in minutes
Yeah.
what was approved.
Absolutely.
Absolutely,
So,
I agree with you.
Okay, so I would move to accept the proposal submitted by Chalmers Ford from Rio Rancho, New Mexico for the trade-in of the 2020 Ford F-150 that Chief is assigned with, well, whatever the current mileage is, $21,000 trade-in, and the purchase of the 2026 Ford Expedition XL SSV 4x4, and the total proposal is $66,842.61. That's equipped and includes the trade-in. So that's the total purchase, $66,824.61. Right?
Mhm.
Oh,
That way,
thank
just
you, good idea. Proposal
Yeah.
number is 091725-16.1.
I will second it.
Thank you, Dennis.
Zach,
Yes.
Joe,
Yes.
Tom,
Yes.
Audra,
Yes,
Thank you, and I'll work on getting some extra documentation.
I want to ride.
Yeah, you better let me turn the lights on once.
Yeah.
I'm okay with what you've provided. If you'll just confirm with them that that's New Mexico State Award, ask them to reference that on your invoice, just so that it's clear for documentation purposes. I'm fine otherwise.
Okay, sounds good.
Cool. Any other questions, comments, concerns?
Just move on.
Is that your concern? So that'll move us to item number 8E, dispatch service proposals.
So I haven't put these out yet because I am waiting on South Metro Fire Rescue to get back to me on whether they will even entertain dispatching for us or not. I do have two proposals, one from Echo 911. They're a company out of Alabama, and they're kind of a startup company. They do mostly security. They have one EMS system. They were on the cheaper end. I think they were right around, let me see if I can find it. Anyway, my concern with them is they have their own cellular radio system. The state won't allow them to use our system, so we wouldn't be able to use our channel. We'd have to use their radios, and they're portable radios, so the staff would have to carry two radios all the time. So I'm kind of leery about that. But their first year, they're totaling $82,992. And then in year 2 and year 3, that goes down to about $4,000 each year. They provide certified EMD dispatchers. They went out and bought a software program that does EMD for them. So on paper, they look really good. Again, my concern with them is the radios.
Yeah.
We do have 2 demo radios from them, and they work fairly well. I'm actually really surprised. We were talking to them in Alabama and one of them in Tennessee.
Oh.
I just think it's a safety issue carrying 2 radios.
Yeah, I agree. That sounds like-
The other proposal is from AMR, and they're giving us a flat $40 per call.
Whoa.
And they provide all the same stuff, certified EMD dispatchers. They already screen interfacility transfers, so they'll make sure that the paperwork's up front, all that stuff's done before our crews go en route. They'll manage the system for us. They'll actually call in the on-call crew if we need them to, so our staff won't have to do that anymore. So they're $40 per call. And then we'll probably have to purchase a radio, so they have our radio channel. They'll be able to use our radio channel. So we'll probably have to purchase a radio for them and have that installed. So that'll be an extra cost. I'm guessing probably $8,000 to $10,000. And then I'm hoping that South Metro gets back to me soon. They already have our station alerting system interface, and so I think that would be kind of seamless. They're dispatched out of Denver, and they'd be able to jump on to our radio channel too. So I just wanted to just throw those out there so that you guys know that I'm still working on that. The only thing that we forgot to do was we forgot to budget for dispatch services in the budget.
Okay, so is that something we'd likely be looking at whenever we do the next budget committee meeting?
Yeah, so yeah, either that, or we can postpone it for another year and see what happens, or I can look for a grant and see if we can find a grant to do it.
I mean, obviously.
My only other concern with doing this is if we ever have to come back to the city for some reason, they're gonna want payment.
Right.
Well, and I think along with that, not only would they want payment, but we would get solid EMD dispatching on every call with these outfits, as well as and we've always been willing to pay, but we need to have a voice and we need to have things corrected, and that's not happening. So that would be my concern.
Can we table this till next month and talk that a little deeper? Because it sounds like you have questions also. I know South Metro really well. They're a really great outfit, and I'd like to make sure that you have all the information you can from South Metro. to make a good decision.
Absolutely. This was more just kind of informational to
Yeah.
kind of give you guys an idea of where we were at. I didn't want a decision tonight.
Cool.
And like I said, we've got to amend the budget anyway if we decide that we want to do this.
Yeah, this is a big amendment. This is a big amendment. We're not just, moving a few dollars around here.
Right.
So this is really throws a wrench into kind of what we've been thinking up to this point. So just my 2 cents.
Yeah.
Well, it's a huge decision. The city's upgrading their CAD system, and they're thinking that might help too. So there's a lot of factors that play into this. Like I said, I just wanted to make you aware, and once we have all the proposals, I'll get those out to you in a board packet, and then we can make a decision from there.
Yeah, I think that's good. I think it's good to keep it something that we think about at least, and then we have options in case things don't go well with the city dispatch as time goes on. My 2 cents is AMR. Like South Metro sounds like the best option, obviously, but AMR we have at least a good bet that they're not going to go away. Where this new place, Echo 911, I mean, if they're doing great, they're doing great. It's cool that their technology's awesome, but they are still in that no man's land of they could just stop existing at any point and then we'd be out. Where AMR, even though they're a private company, they could likely disappear if they wanted to, but they're huge and they've got their hands in too many pots to just dissolve. So that's my 2 cents. I think South Metro is obviously more our style, but I think it'd be good to just put it back on the agenda as you have proposals and more information, and I appreciate you letting us know.
Absolutely.
We're going to always sell your truck.
Do you think the dispatch could cost about like $66,000? Just an idea.
He can use Uber.
Yeah, we'll get you an Uber.
I bet Chief's not smiling.
There you go.
Yeah, I don't hear him laughing very much.
Question on the 26 budget.
Sure.
Did I hear Barbara mention that then there's got to be a public hearing or not?
Yeah.
Yes?
Yes.
So, and that's a separate process and then,
We just do that at the next board meeting.
okay.
I'll post it. I'll get it in the paper. It'll be posted in the paper and everything.
And so, just an education for me. So, should we have had the public hearing before we approved the budget?
Well, you just approved the draft.
Okay.
You looked at the draft and
the
you're like,
budget,
okay, we're good with this. Now we'll go ahead. We'll have
Okay.
our hearing.
Yeah, right.
We'll
Just a
open it
draft.
up. Yeah.
So we have an opportunity with respect to dispatch, if we want to change it before we finalize the
That's
budget.
correct.
too.
Absolutely.
That's
Okay.
correct.
Absolutely.
Okay,
That's
I feel better about that.
Yeah.
I have
It's
another
just,
question, or
it's just
I
a big
guess
number. I
have-
wasn't thinking that big of a number to make
Right.
an adjustment.
For sure.
Yeah.
Right. I have one more comment about dispatch. I think similar to what all of the emergency fields are realizing, dispatch is part of that. And so it's been a constant struggle for the city to retain employees, even attract and retain employees. And so I think that's probably some of what the ambulance service is experiencing. We have some that have just kind of hung on, but it's been a revolving door. So just putting that
Yeah,
out there.
fully staffed there at 9 people, which isn't nearly enough anyway for them to properly do EMD. So I'm not saying that they're doing anything wrong or malicious. It's just they don't have the staffing to do it the way we need it to be done. And so this was just an option to see if there was something else out there.
Yeah, I mean, I can see the need in
So
it,
that's all.
especially as we're going towards like community paramedicine. Between that, interfacility transfers, secured transports, and 911, it's like that's a lot of stuff for 9 people to handle on
And
top
there's only
of police and
Yeah, it's a
fire.
huge burden.
There's only
Right.
4 of them.
Yeah, so, yeah, that's,
They have 9 positions, but there's only 4 of them.
yeah, they could be the best dispatchers in the world, and it's just too much for them to handle.
That's a great point.
So,
Well, and in all honesty, I hope that they see this as a partnership to help kind of alleviate their workload,
Right.
because they'll be able to transfer the medical calls, and they won't have to take the call and go through all the questions and stuff.
Right.
They'll be able to just dispatch.
Yep.
And then the other thing I wanted to just make you guys aware of is the reason we did this draft budget so quickly is because by state law, we have to present it to the board before October 10th.
got it.
So that's why we pushed this through to get the draft budget going.
Got you.
Got it.
And then it has to be submitted by December 10th.
Right.
And for years, and it's gonna happen again this year, the November meeting falls on Thanksgiving. The December meeting falls on Christmas. So we've always tried to like get everything in line before the holidays start.
Well, we could do the thing, I'll probably, we'll revisit it then, but like we did last year where we put, instead of missing 2 months, we put one at like the beginning of December.
Yeah.
And then that way it falls in the middle, it's not on a holiday. But yeah, I think I'm very happy with that information. What's up?
I would just say that the November meeting is the day before Thanksgiving. I'm looking at my calendar.
Yeah.
I was
Out of town.
intending to be out of town.
Here's the real truth.
Yeah.
Do we want to do it the week before?
Well, we can wait. We've
Yeah, we
got
can,
time.
we can
Alright.
decide over
Yeah.
the next month and bring it up at the next meeting,
Yeah.
since it'll be the next one coming up at October.
Seems like a year or two ago, we did it early in November.
You did last
Yeah,
year.
so last year, because the year before, we did where we didn't do November or December,
Right.
and it was just, we both agreed that it was just too much of a gap.
Yeah.
And so, I felt like I didn't know anything, and I'd gone to summer vacation from school and forgot
Yeah.
all the math.
Okay.
And so, yeah, we did, I think it was right at the beginning of December, because instead of the end of November, we just did, I think it was, if I remember correctly, this might be my savant. I think it was December 11th.
Wow.
I don't know, don't quote me. What's up,
Chief
Bubba?
has a hand up.
Or what's up, Chief?
Oh, I was just curious. I thought I'd cut off Audra. I thought you were gonna say something else about dispatching, and I was curious to hear what you had.
No, that was it. Just
Oh, okay.
the lack of personnel.
Yeah.
Okay.
But I agree with you. I think it is a thing that, I mean, finally a lot of other organizations or parts of the industry are starting to realize that dispatch is easily, they're a huge part. There's everything that can happen before the ambulance or the police or fire even get there.
Did you know that just last year, dispatch became an essential service?
Really?
Through COVID, they were not considered essential.
Wow.
They're the ones who tell everybody where
Yeah.
they need to be. Yeah, they
Yep.
were not considered essential.
Yeah.
You know what's crazy? We're still not an essential
Still not.
service.
I know. Yeah, it blows my mind. They were considering letting liquor stores and dispensaries be essential, and we are not. Yeah. Well, any questions, comments, concerns? And that'll move us on to item number 9. I will entertain a motion to adjourn.
Don't we need to?
Oh yeah, we're missing a thing on here, huh?
What?
Just
Oh.
Let's set the next regular meeting date.
Well, but that wasn't on the format for the meetings that's in the bylaws. So you could just say when it is. It's October 22nd.
Yeah.
Okay.
Yeah, I've got October 22nd, 4:30. And I'll entertain a motion.
I make a motion.
Second.
Thank you. That's the slowest adjourn
I know.
that's ever been in here.
Ta-da.
Zach,
Yes.
Joe,
Yes.
Tom,
Yes.
Audra.
Yes.
What time?
It is 18:35.
Thank you all.
Thank you.
Thank you, guys.
Thank
Have a safe trip home.
Have a good